Frontotemporal dementia, FTD, is a clinically and pathologically complex disease. In NFV-PPA, peak atrophy is found in the inferior frontal gyrus, dorsolateral prefrontal cortex, and supramarginal gyrus of the left hemisphere. Compared to both SVPPA and BV-FTD, NFV-PPA demonstrates greater progressive atrophy in the parietal lobes, but relatively spared bilateral temporal pole, parahippocampal, entorhinal, fusiform, inferior temporal, middle, and left superior temporal gyrus. Now that your radiation treatments for oropharyngeal cancer are complete, it will be important to maintain consistent skin care on your neck as well as the inside of your mouth and throat. Proper healing from the radiation you have received will take time, but with consistent care and immediate attention to any mouth sores or skin irritation, these side effects should subside. Some infections can be chronic. Tell your doctor if you have lived in or traveled to an area where infections called histoplasmosis, coccidioidomycosis, or blastomycosis are common. Lymphoma and other cancers have been reported in children and teenage patients taking TNF blockers. A rare type of cancer called hepatosplenic T-cell lymphoma has developed in some patients. Cognitive behavioral therapy, CBT, is a practical short-term form of psychotherapy. CBT will help your patients develop skills and strategies and give them reliable self-tools in regaining their mental health. Using a measuring tape, determine the circumference of the patient between the hip and natural waist. You can also use the patient's pant size to determine the size of the brace. Before sizing the belt, remove the pull tabs from the brace to allow for easier adjustment. Then slide the plastic rivets out from the dynamic grip opening. Reposition them in the appropriate size setting and pull to lock in place. Once the catheter has been guided through the blood vessel to the coronary arteries with the aid of a special X-ray machine, the coronary angiogram can begin. Digital photographs of the contrast material identify the site of the narrowing or blockage. With intravascular ultrasound imaging, a miniature sound probe is positioned on the tip of a coronary catheter. The catheter is threaded through the coronary arteries and using high-frequency sound waves produces detailed images of the inside walls of the arteries.